I'm Anita Chabria, a staff columnist with the Los Angeles Times. It was 2 years ago this month that Los Angeles went into a lockdown because of a mysterious virus not fully understood. Over 900,000 Americans are now dead from complications of the virus. Millions more are experiencing lingering side effects. And yet, Los Angeles, like much of the nation, is turning a corner. 71% of LA County is fully vaccinated. Restrictions are easing. The masks are coming off in several public spaces like gyms and restaurants. All of this, in a large part, due to vaccines. But there are still questions. Does the current crop of vaccines offer lifetime immunity against the coronavirus? Will we need an annual booster shot? What's the future of vaccines? And could the science behind the coronavirus help treat other diseases like cancer? There is a lot to discuss. With me to break it all down are Dr. Vivek Naranbhai with the Dana-Farver Cancer Institute and the Massachusetts General Hospital Cancer Center, and Dr. Peter Hotez, the Dean at the National School of Tropical Medicine at Baylor College of Medicine in Houston. Before we jump in, a few disclosures. I want to acknowledge that Dr. Pat Soon-Shiong, the chairman of the Los Angeles Times, is CEO of the biotech company ImmunityBio, which is manufacturing a COVID vaccine created by Dr. Hotez and his team. Welcome to both of you. Dr. Hotez, let me start with you. Just quickly, your reflections on where we are 2 years into this pandemic. Are we entering a new phase and hopefully perhaps the final phase?
Well, I think possibly yes to the first question, much more murky for the second. So the number of Omicron cases is going down dramatically across the country. We're now getting below 50,000 new cases a day. Not perfect, but far better from where we've been. And so we are reaching a nadir. And so I think we're entering now a new post-Omicron era. The question is now what happens after that? And I'm of the opinion that the herd immunity induced by this Omicron wave, together with the vaccine-induced immunity, is not going to be substantial, mostly because Omicron is not causing much in the way of long-term protective immunity. And I think, unfortunately, that means we're going to be vulnerable to another wave this summer or towards the end of this year.
And is that something where you feel another booster shot might be required for all of us?
I think two things have to happen. One, we still have to close the vaccine equity and vaccine hesitancy gap. We still have another 10 to 30% that are eligible but are being defiant or refusing vaccines. That has to happen. So we still have too many Americans who've not even gotten a single dose of vaccine. And I do think we're going to need a second booster. I think that will help correct some of the waning immunity that we are seeing after boosters, especially if it's a variant that resembles Omicron. So I think we're going to need both of those things to max out our ability to vaccinate the US population.
And what about vaccines for our youngest kids? Are you hopeful there?
Yeah, we had some somewhat disappointing news in terms of the effectiveness of the vaccines in the 5 to 11-year-olds. Some of the data coming out of New York State suggest only about 12% protection against infection, although the protection against hospitalization is much higher. A follow-up study from the CDC, from the Vision Network, suggests 74% protection there, but we still could do better. And I think what happened was you see a big drop off in the protection after the dose went from 30 micrograms per dose in the 12 to 17-year-olds compared to the 10 microgram dose in the 5 to 11-year-olds. So I think it's a dose problem, which we could either correct by doing new dose ranging studies or more likely give a third immunization, a booster, and hopefully that will correct it. And we may have to do the same thing for the under fives as well. This is likely going to turn out to be a 3-dose vaccine.
Dr. Naranbhai, I'd like to turn to you for a moment and ask you about T-cell vaccines. What is that? We've heard so much about it. And is it something that could provide lifetime immunity against COVID or its variants?
Well, I think the hope is that thinking about our vaccines and the next generation of vaccines will yield benefits. Just to take a step back, the human immune system is really a beautiful thing. It's like a whole military that has different divisions. And if you think about it, we have antibodies that are like missiles that you can produce in one place and they can go and neutralize the virus entering a cell. And then you have this other arm of the immune system that's probably less talked about, but probably as important, the T cells, which are like hand-to-hand combat. So if a cell is infected with the virus, let's say the virus got into your nose and it got into one of the cells in the lining of your nose, it's the T cells that can recognize and kill that cell. Now, the reason there's a great deal of hope about vaccines being able to work better if we can make better T cell responses is because we think that the T cells may be more durable, so they may last longer, and perhaps they may have greater breadth. And just learning from Omicron, we learned that even though if you didn't have a booster, your antibodies were not adequate to protect you against Omicron, it turned out that most people's T cells, if they've been vaccinated, cross-recognized Omicron, telling you that T cells probably have greater breadth. Now, the three vaccines that we're using in the United States all do make T cells as well as antibodies, and it's likely that any vaccine we need makes both arms of the immune system, but they don't make great levels of what we call CD8 T cells, the T cells that we think are those arm-to-arm combat kind of soldiers in our body. So the hope is that the next generation of vaccines will do better at making more T cells as well as antibodies, and maybe off the bat of that, we'll get better durability. Now, what we know is that antibodies are probably necessary for protection against infection, but the T cells are playing a really important role in protecting people who've been previously infected or vaccinated and then get infected, preventing severe disease in those people. And so, I think that it's going to be really important that the next generation of vaccines make good antibodies and really good T cell responses.
I love how you explain those T cells as hand-to-hand combat. I think that really helps us all get a sense of what they do. And I love thinking about having them in our bodies, right? Fighting that fight. But you also are an oncologist and cancer is your specialty. Do you think the science behind the coronavirus, what we've learned in this last year, will benefit other diseases like cancer?
I think this absolutely. I think the science of what we've learned in coronavirus has sort of three major implications. First, there's just the breathtaking speed at which interventions were developed and sort of rolled out in the United States and around the world. Now, as Dr. Hotez said, we haven't done as well as we wanted to in terms of getting it to every American, and we've done even less well at getting it to every person around the world, every human being. And that's important because, like cancer and COVID have something very similar in that they're evolving to escape the immune system. And if we let continued transmission go on in COVID, we're going to get new variants arising, and those pose a threat to everyone, vaccinated or unvaccinated. So I think that the first point is that the breathtaking speed is something we can learn about in cancer. The second thing is that we've learned a lot from COVID about what technologies we could use to tackle cancer. And I think the mRNA vaccines, never before have we had a licensed mRNA vaccine. I think we're going to definitely want to exploit that technology to try and do better at generating responses in cancer. So there's the technology aspect. And then the third thing is really coming back to the fact that COVID, like cancer, evolves and escapes the immune system. And what we want in a COVID vaccine is going to be one that can protect against current variants and future variants that can escape current immunity. So this evolution issue. And it's the same thing in cancer. We want to be able to design a vaccine that can take care of the current cancer, but knowing that the cancer is going to learn to evolve immune responses. And so I think that we're learning a lot of details about how you design those kind of vaccines, what kind of what we call antigens, pieces of the virus or pieces of the cancer we're going to need to put in the vaccine. And so I think COVID, is teaching everyone what can be done if we bring our heads together to fight the big issues confronting humanity.
Wouldn't that be a silver lining if a cancer vaccine was somehow on the horizon, or at least possible because of it? I know we have other vaccines, Dr. Hotez, that are administered as nasal sprays and things like that. Do you see any alternatives to shots coming for COVID vaccines?
I think it's possible. We're certainly looking at it as what we call a mucosal delivery mechanism, meaning through either an intranasal delivery mechanism or sublingual under the tongue, or oral vaccines. We do not have a lot of vaccines that use that technology. Flu mist is an example of it. So I know there's a big effort to try to shape vaccines in that way, and we're part of that. But we'll see how quickly we can move in terms of comparing that to parenteral vaccine, meaning intramuscular vaccine. But remember, even if it doesn't work out for COVID-19, I think the vaccine ecosystem is still very committed to this.
Dr. Naranbhai, I wanted to go back to something you said earlier about how quickly this COVID vaccine was approved. There are some people who think perhaps that approval was too fast. What do you think?
I think that the biomedical system has lots of inefficiencies in it. And what COVID proved is that we can overcome those inefficiencies to do science and to do regulatory oversight as well as we should, but in a shorter amount of time. I think COVID was unusual in that there was a pressing public health need. I think if regulators sat on their laurels and didn't consider the science quickly, didn't help to look at this trial designs and provide rapid input, everybody would have been accusing them of being too slow and costing lives. I think that the right oversight was done, and I think that we've resulted in in several vaccines that work really well, and a number of other vaccines like Dr. Hotez's and like others that will prove to be very valuable in the fight globally against COVID and other diseases.
I want to pose this question to both of you. Moving forward, what's our relationship with this virus going to look like? Are we ever going to be rid of COVID, or are we going to live with it?
One of the things that we've learned is our worst variants of concern, both Delta and Omicron, arose out of unvaccinated populations in low and middle income countries. Delta arose out of an unvaccinated population out of India in early 2021, and Omicron later in the year out of Southern Africa. So, Mother Nature's telling us what she has in store for us. As long as we refuse or delay to vaccinate the world's low and middle income countries, she's going to hurl new variants at us. And so I think that's the message, that we've got to redouble our efforts to vaccinate the African continent, the low income countries of Southeast Asia and Central America and tropical Latin America and South America. And if we do that, I do think we can vaccinate our way out of this pandemic. But so far, there's not been a huge amount of political will to make that happen.
Those are such an important point. Dr. Naranbhai, what do you think the future holds?
I think I want to support Dr. Hotez on exactly what he said. The single most important thing we can do is to address the issue of vaccine equity in order to overcome and to try and shorten how long this is. I don't think we're at the end of this. We're going to have other coronaviruses that cross the species barriers from bats into humans, and we're going to have other variants of the current COVID-19 pandemic. One way we can tackle that is building the infrastructure and dealing with it at a global scale. And we have a track record of that, right? The President of Emergency Program for AIDS Relief, PEPFAR, in 2003 was the largest commitment of any country to deal with a single problem. I think we need a global emergency plan to deal with pandemics, starting with COVID-19, and dealing with the issue of vaccine equity and getting vaccines available to people around the world, and overcoming the sort of hesitancies that people may have by showing them the science and communicating what we know that vaccines do to save lives.
I want to thank both of our guests for joining me today for this thoughtful and important discussion. It will be interesting to see where things stand in another year. Thank you both again.
Thank you very much.